Welcome back to TV5 News at 9. It is now time for Medical Moments with Covenant Healthcare. Today we are talking about the coronavirus. With me here today is Dr. Matthew Dybul, the Director of Covenant Emergency Care. Thank you so much for joining us today.
Absolutely. My pleasure.
You know it was inevitable. Now
Absolutely.
We have 2 cases of coronavirus now confirmed in Michigan. So let's start off with what people need to know about the virus, Doctor.
Sure. I think we've heard so much in the news so far. One of the things to keep in mind is it's called coronavirus because it's a virus. When people get infected, there's usually 2 ways. One is viruses and one is bacteria. Bacteria are things like an abscess or things like that, and we do antibiotics for bacteria. Viruses, though, viruses are those basically colds. It can be sore throat, cough, it can be shortness of breath,
so with
it can be GI symptoms.
What are the common symptoms for this one that you're talking about?
So for the coronavirus right here, we can see some of those same virus symptoms. So cough, fever, shortness of breath, but it could also be GI symptoms and other things that we see with viruses.
Okay. Now, just because a person has these symptoms, that doesn't mean that they have the coronavirus. So what criteria do health providers look for?
Okay, you are absolutely right. The vast majority of these symptoms are not going to have coronavirus. So the symptoms they're really looking for are, in particular, to come to like an emergency department, is significant shortness of breath, along with that fever and that we would see.
Now, just because a person has these symptoms, do they need treatment?
No, and in fact, again, since it's a virus, the treatment that we do give is really just supportive treatment. So we're giving, at this point, maybe we give it oxygen, maybe IV fluids, things like that.
So if I think I'm infected, what do I do? What's the next step?
Oh, great question. And I think that's kind of a question on lots of people's minds. Right now, if you are sick enough that you feel like you need to be in the hospital, so you're having a hard time breathing, that's obvious. Get over to the emergency department. If you've been traveling and you're coming over, it'd be good to let your doctor or the hospital know first. However, if you're just kind of got the sniffles and a cough and you've got a little bit of shortness of breath and a fever, in that case, you're probably good just staying home and isolating yourself from others. So if we really don't want to spread in any kind of infection, and now in the time with seeing this, we want to be even more sure that we are not spreading infections.
So you don't want to like flood the ERs or urgent care in your doctor's offices. You know what I've seen, Doctor? A lot of people walking around with masks on. What do you tell people about wearing a mask? Is it necessary?
Yeah, so the masks are a little controversial except in one circumstance. If you are ill and you're going to be out in the community because you have to be for something, please wear a mask. And that minimizes how much whatever you have is being spread to others. But if you are well, wearing a mask, it's not as clear if it really helps or even possibly hurts.
Okay, Doctor, you know, most importantly, how can people prevent the spread of the coronavirus? We keep hearing the cases going up and up and up every day. How do we prevent this?
So you're exactly right. That's the most important thing that each of us individually can do is help prevent this from spreading. And you've heard it on the news over and over again. Wash your hands, try to touch your face. If you are sick, stay home. If others are sick, try to avoid.
Doctor, I want to just touch on this briefly. Panic, not to panic. When we hear 2 cases now in Michigan, people are worried, they're concerned, kids are worried. What do you say about this panic?
So, again, this is a virus, and most people are actually going to have very mild to no symptoms. And it really is not going to be a big deal for most people. The problem is we know that a small subset of people, it tends to be the elderly and those with lots of medical problems, for some of them, they tend to get sicker. The good news is for children, for instance, we're really not seeing kids get very sick with this at all. They're just staying in the very mild symptoms.
That's great. Anything else you want to add that we have not covered about the coronavirus?
I think just if you're unsure, please give your doctor a call, and they're going to help guide you in which direction you need to go.
That's great. Thank you, Doctor, for stopping by. It's very timely. We appreciate you taking the time out to be with us. And if you have any information, if you want any information about this, please head over to the hot link section on WNEM.com.